minutes.
Very good afternoon to all of you. Actually, Phaco emulsification in white cataract, the things become very easy once you finish the rhexis. That's why I'll just concentrate basically on rhexis part. So, white cataract has 4 types: the golden, nuclear, hue and hard consistency, swollen intermittent cataract, Morgan cataract, and white cortical cataract, that is smoking or clefting or corticocapsular adhesion. So, this is the basic etiology that imbibe the aqueous through semi-permeable lens capsule. That lens ultimately swells and hydrostatic or intralenticular pressure grows up and phacomorphic glaucoma might occur. The characteristic is that the depth of the anterior chamber is usually less than 2 mm, angle of the AC is less than 40 degrees, lens thickness is usually more than 5.5 mm, shape of the lens decrease the aspect of the biconvex lens and it becomes spheroidal. So, I will not come into details of this I will go for videos only. This is the first video where we promise for a premium IOL. Things goes well nicely. Suddenly it starts going out, and see, I tried to push the capsule holding forceps, asked my assistant to bring biscoat, tried to enlarge the side port. By that time, everything finished. So, my feeling is that once you have the white cataract of like this, you must have the all sorts of armarium and you must be very careful and energetic to finish the surgery as early as possible. Finish the surgery, finish the rhexis as early as possible. See the next case. Mouse. With cystitome, I tried to do the rhexis. Giving the centripetal force, centripetal direction all the time, just pulling the rhexis towards center. Here I am not using micro-axis forceps. Basically nothing different, only thing is that you have to be consistent, very patient, because if you finish this part, your things become very easy. So, this is finished. This is another one where we tried with micro-axis forceps. This is very important tool, we must have a micro-axis forceps with you. Here you hold the end of the rhexis and grabs it. Do not try to finish like this. Re-grabs, release it, and ultimately it finishes. So, this case, I thought it will be very easy. See what happened ultimately. People were slightly small. I did the staining. Finished the rhexis. I thought I should do some sort of hydro. Not at all happy with the hydro. Did a forceful hydro. Now also not happy with the hydro. It's not rotating. Ultimately it rotates like anything and sinks down. This is another one. Morgagnian cataract. Vasta. One important point is that in many cases, these sorts of cases, usually we inject too much of visco. That should not be, the intraocular pressure should not be high. This is small rhexis I tried. This rhexis is not sufficient. So now the interlenticular pressure has gone down. To some extent I did the debulking and enlarge the rhexis. This is the next. This is my most favorite technique. Yes, run it. This is my most favorite technique. No, not this one. Yeah, this one. Without doing anything, I just debulk the, see, debulk the nucleus with Phaco probe. The central part of the nucleus with the anterior capsule is eaten up. In that case, we are just reducing the interlenticular pressure. Then, as usual, we are finishing the rhexis part. So these are few tips. Once you finish, usually these sorts of cataract are usually softer, and usually these sorts of white cataract doesn't give much problem once you finish the rhexis well. So this part is over. I think I finished within stipulated time.
Thank you.